as we wind down October, which is Breast Cancer Awareness Month, we wanted to talk with an expert about some of the ways viewers can catch breast cancer early. So today we are joined by Dr. Mackenzie Lesh with Mercy, who is a fellowship-trained breast surgeon and the only female breast surgeon in town, Southwest Missouri area. So thank you so much, Dr. Lesh, for your time, and thank you for what you do.
Thank you so much. I'm really glad to be here.
Yes. Okay. So as I said, October is Breast Cancer Awareness Month. So as a breast surgeon here, where do you come in during the breast cancer journey?
Yeah, so patients come in and see me usually right after they've been diagnosed with a breast cancer. And so I'm a lot of times the first doctor that they're seeing that's talking about all their options for treatment and letting them know what everything is going to look like and how they're expected to do with all of this.
Mm-hmm. How common is breast cancer?
So 1 in 8 women will be diagnosed with a breast cancer in their lifetime, which is kind of crazy to think about. It's the most common cancer in women, aside from skin cancer, which is the most common in everybody.
Oh, wow.
So.
Okay, so for females that either have a family history or like they're just getting diagnosed, what is a common question that you get about breast cancer and then that journey?
Yeah, so most people want to know, what stage is it? How am I going to do? Is this treatable and curable? And so that's always the first thing that I go in, ready to answer for them, to let them know that most of the time, these women are diagnosed with early stage breast cancers that are very treatable and very curable.
Mm-hmm. So the trick is to catch it early.
Right.
And I'm assuming mammograms are the best way to do that?
Yes, they most definitely are. It's amazing. I see so many patients who come in, they're just getting their screening mammogram, they had no symptoms, a lot of times no family history, and they've been diagnosed with a small early breast cancer that they would never have felt otherwise.
Right.
It allows us to catch it much earlier than it would be if they had waited until they felt it.
Wow.
Speaking of the feeling it, I know that, self-breast exams are highly encouraged for women, but breast tissue is kind of hard to decipher.
Yeah.
What's a nodule and what's not.
Yeah.
How can we make that easier on ourselves?
Yeah, that's an excellent question. So I usually tell people to do this exam just once a month, around the same time of the month, because a lot of us have hormonal changes throughout the month that will change the way that breast tissue feels. And then I also tell people, if you feel something on one side, check the mirror image of the other side. So if it's the upper outer breast, check the upper outer breast of the other side. And if it feels similar, a lot of times that's just their normal dense breast tissue sort of scattered around.
Okay.
I want to ask you a question about treatments. Mm-hmm. So we were talking before the commercial break. My grandmother passed of breast cancer. Again, no family history in our history. With so many women in my family, no history. She caught it. They did a mastectomy. They did a lumpectomy before that, and she went through 2 different rounds. What does the treatment look like now versus the 90s? I know we've come a long way.
Yeah, so we've got a lot of research showing the safety of a lumpectomy versus a mastectomy in people that have small enough tumors that we can get around it well. And so a lot of times we're able to offer that, especially since we're finding so many breast cancers early. When it comes to the changes with mastectomies and things like that, long ago we used to remove, the muscle and the entire breast and skin, and so we are able to do reconstruction now, save a lot of that skin. We don't take the muscle anymore. Usually, and they used to remove all the lymph nodes and everything, long ago, and now we really try to limit the lymph node surgery that we do as well, so that people aren't having the side effects of surgery like arm swelling or lymphedema down the road.
My grandmother had the lymph nodes removed. I mean, they were like, yeah.
Yeah.
So when you're talking, I'm like, yes, we've lived through that.
Mm-hmm.
Yep,
yeah,
exactly.
Absolutely. A lot of people know somebody who's gone through that.
Yeah. I'm just curious, where did your, passion kind of spark for breast cancer? Was it somebody in your family? Like, why did you want to go into this?
My grandma did have breast cancer when she was older. She was over 70. But, I think that the main reason that I went into this was because when you're in surgery training, you meet a lot of patients, but you don't get to see them on the long term. A lot of times you meet them, you do surgery, and you don't see them much afterwards. And this is one of the fields in surgery where you really get to have a relationship with your patients long term, which is incredible. So that's really valuable to me. I mean, my patients are amazing, and you're meeting them in a really difficult time in life, and you're able to kind of ease them through that and help them to feel a little bit more at ease when they've gotten this scary diagnosis.
Doctor, I know there's probably no answer to this question, but I'm just so curious. What causes breast cancer? Why is it so common? And I feel bad for so many women because 1 in 8 women, you said, have to deal with this. I just don't understand why it's so prevalent and why it's so common.
Yeah, and so our biggest risk factor is just being female. A lot of breast cancer is hormone driven, and so I think that's a big reason why it's really a thing in women most of the time. But there are a lot of factors, and so one of the things that I always think about is that every person can get their risk assessment, because things like how early you started periods, when you had your first kid, how dense your breast tissue is. All of these things are factors. Even things like BMI and things like that all weigh into our risk. And so it's hard usually to pin down one thing that led to someone's risk. We usually can't say, a lot of times we say it's, the fact that you're female, it's bad luck, those kinds of things. But sometimes especially if you have a family history, you can seek someone out and get one of those risk assessments and see if you're identified as high risk.
Gotcha.
You could get extra screening if that's the case.
Okay.
Okay, so for our viewers, what is the best way to just learn more about breast cancer, what you do, and if they need your resources to reach out?
Yeah, that's an excellent question. So, of course, there's a page on me at Mercy's website that you could read a little bit about that, but there are also really excellent websites out there that give more information about breast cancer and information like that. There is an organization that's, I think, especially helpful for women who are diagnosed recently. That's breast360.org that gives a lot of information about the different treatment options, and it's really valuable and informative information that's more accurate than some of the resources out there.
Doctor, thank you so much for
Dr.
coming.
Lesh.
Thank you so much for what you do.
Thank you so much for having me. This is an honor.
Yes, guys. All right, we'll be back to show you Andy's newest monster creation right after this.